I am Dr. Joel Hyatt. I'm a family physician. I'm Emeritus Assistant Regional Medical Director for Kaiser Permanente, Southern California, involved with community health improvements. But today, I'm here representing members of the Los Angeles County Prescription Drug Abuse Medical Task Force to make an important announcement about standardizing emergency department practice across the entire county of Los Angeles. We have three goals. The first is to establish a standardized clinical guidelines and patient communications that will provide for safe and appropriate pain management and opioid prescribing in all emergency departments in the county. Second, we want to reduce the risk of overdose, misuse, abuse, and diversion of high-risk opioid medications. And third, and lastly, we want to reduce doctor shopping and emergency room shopping for pain medications. With outstanding leadership from this task force, which has helped sponsor the initiative and has engaged emergency departments throughout Los Angeles County to put these guidelines into practice, we can be part of the solution to the opioid abuse epidemic. You have a list of members of the task force in your press kit, and now we're going to hear from three representatives from the task force, Dr. Jeff Gunzenhauser, Dr. Maureen McCullough, and Dr. Pedram Salampour. Then we'll have general questions and answers, which we'll field here at the podium, followed by time for you to get any one-on-one interviews that you may want from individual participants. And we do have representatives from the Hospital Association of Southern California and the Emergent Medicine Associates and the Community Clinics Association of Los Angeles County. Our staff will also assist you in getting any B-roll of emergency department signage in front of the hospital. At this point, let me turn this over to Dr. Gunzenhauser.
Thank you, Joel. Good morning. I'm Jeffrey Gunzenhauser. I'm serving as the Interim Health Officer for Los Angeles County, and I work in the Department of Public Health. Along with Dr. Hyatt and Dr. McCullough, I'm serving as a co-chair of the Prescription Drug Abuse Medical Task Force here in the county. And I can tell you that I'm very pleased and very proud of the collaborative work that we've done together so far to date. What I want to do briefly is highlight the public health impact of this epidemic here in Los Angeles County. According to the Centers for Disease Control and Prevention, there's an epidemic of prescription opioid overuse, overdose, and deaths occurring nationally. And as you can see in this chart here, this relates to the increase in the sales of prescription opioids during about a 15-year period. You can see that from 1999 on the left to recently in 2010, the amount of prescriptions sold more than tripled during that 11-year period. Nationally, drug overdose death is the leading cause of death injury in the United States. Among persons between the ages of 25 and 64, there are more deaths due to drug overdose than there are from motor vehicle accidents. When we specifically look at opioid deaths, the number nationally is over 16,000 Americans dying from prescription opioid deaths each year. And if you look on this table here, you can see in the red line that the number of deaths from prescription opioids is greater than deaths from heroin, benzodiazepines, and cocaine combined. Here in Los Angeles County, the impact of this epidemic is very high. In 2013, we had nearly 400 persons die from prescription opioid deaths. During that same year, there were more than 9,000 visits to emergency departments in our county for prescription opioid issues, and there were over 14,000 hospitalizations related to prescription opioid issues, costing our healthcare system more than $700 million. So, the local impact of this epidemic on Los Angeles County is very serious, and it's time for us to take action. Throughout our community, prescribers, providers are overprescribing these high-risk medications. There's been new evidence to show that such use really should be restricted just to persons who have severe non-cancer pain. And even in these individuals, the doses should be of short term and also at low doses. You can see here in this slide that if an individual is receiving about 100 equivalent morphine doses, which is shown on the right, their risk of overdose and death is increased by a factor of over 11. So who are the people that are abusing the use of opioid prescriptions? When we've analyzed this, what we've seen that over 72%, or about 72% of these individuals are receiving these medications from family and from friends, often directly out of person's personal medicine cabinets. So our collaborative here in Los Angeles County illustrates how, when we work together collaboratively, a great common good can be addressed through partnerships between the public and private sectors. On behalf of the Department of Public Health, I do want to say that we support the CDC's goal, which is to reduce the impact of prescription opioids on causing overdose and death, while at the same time reaching our goal of providing effective and safe therapy to those who are in pain. So at this point, I'll turn over the podium to Dr. Morgan.
Good morning. My name is Dr. Maureen McCullough, and I am with the Department of Health Services, Los Angeles County. All of you UCLA Medical Center, Department of Emergency Medicine. I'm also a member of the California chapter of the American College of Emergency Physicians. There's a few statistics that you should know. There we go. There's a few statistics that you ought to know. For every death from prescription opioids, there are 10 hospitalizations for abuse, 32 ED visits for misuse or abuse, 130 people who abuse or are dependent upon prescription drugs, and 825 non-medical uses of prescription drugs. Now, we as emergency department physicians are very good at treating acute pain, but we're also in a good position to identify and help prevent the overuse, the abuse, and the diversion of prescription painkillers. The American College of Emergency Physicians in 2012 and the American Academy of Emergency Medicine in 2013 both published clinical guidelines for the safe and appropriate use of painkillers in emergency departments, specifically opioids. Kaiser Permanente of Southern California, San Diego and Imperial Counties, CalASA, which is again the California chapter of the American College of Emergency Physicians, and now our own task force here in LA County, have adopted guidelines for the safe and appropriate use of opioid medications in emergency departments for chronic pain patients. With the funding from Kaiser Permanente Community Benefits, we printed and distributed a 2-month supply of handouts, patient handouts. About 386,000 handouts were distributed to 75 emergency departments here in Los Angeles County back in July 2014. We've now networked with all of these emergency departments to help them support the guidelines, help them adopt them, and help with the distribution of these guidelines, of these handouts to patients once they've been seen in the emergency department. This includes all of the LA County DHS hospitals, Kaiser Permanente, Providence, Dignity Health, Memorial Care, Adventist, and others, including the emergency physicians from Emergent Medical Associates, and we have 2 other representatives here in our conference this morning. They staff many of the emergency rooms in Los Angeles County. Let's just go over the guidelines. I'm going to just flip to the guidelines. Oh, there we go. So what do the guidelines actually say? Well, the guidelines communicate key points to the patients that we see in the emergency department. The first is that patients who have chronic pain really need to receive their medications from one provider and one pharmacy if they're being treated for chronic pain. If the patient already receives chronic pain medications from an outside provider, then in general the emergency department won't be writing for any more. If pain prescriptions are, however, needed, then a small amount will be written for, let's say 3 days worth. We don't want an extensive use of medications. It can lead to diversions and overuse, and we really want the patients to be followed by their regular providers. We will not refill stolen or lost prescriptions. If a controlled drug is stolen, it needs to be reported to the police. Emergency departments don't write for long-acting medications such as MS-Contin or methadone, fentanyl, or OxyContin. Again, these are medications that need to be really filled and prescribed by a regular doctor or clinic. Injections or infusions of opioids will not usually be advised in emergency departments for patients that are already on chronic pain medication. Medications taken by mouth will be offered instead. And lastly, emergency departments are encouraged to use the state prescription drug database. It's a prescription drug monitoring program known as CURES. And what this does is helps track controlled substances and allows for safer prescribing. As always, the ultimate care of the patient is decided by the individual provider that's seeing the patient in the emergency department. But our goal is that if all emergency departments follow these same guidelines and communicate the same message to all patients, we can establish a consistent ED practice across Los Angeles County that can help lead to reduced opioid abuse, overuse, diversion, and the ED or doctor shopping that occurs for painkillers. While this is a work in progress, I am pleased to report enthusiastic support for this initiative across LA County. Now please welcome Dr. Pedram Salampur from LACNA.
Thank you very much, Dr. McCullough. I have to say, that's got to be one of the most frightening statistics I've heard in a very, very long time. More deaths from prescription opioids than from cocaine, heroin, and benzodiazepines combined. That is absolutely frightening. My name is Pedram Salampur, and I serve as president of the Los Angeles County Medical Association. While this task force consists of representatives from many important organizations, I want to stress that this is an initiative of professional organizations. It's a clinical program supported by a California chapter of emergency physicians and the Los Angeles County Medical Association and our 7,000 members. This is not a government program. It's a voluntary and important response to by the entire medical community, including emergency physicians and others, to the issue of prescription opioid overprescribing. This is a safety and quality initiative that I'm proud to be a part of, and I can tell you that the Los Angeles County Medical Association is also very proud to be a part of this association. But everyone can play a role in promoting the safe use of medications and prevent the unintended medication reaction or death. Truth is, everyone has to play a role. For this to work, everyone has to play a role. So here's how. Take the medications you're prescribed, not more, not less. You have to take your meds exactly as they've been prescribed by your doctor. If one is good, two is bad. Never take someone else's pain meds. Pills aren't for sharing. They're a federally controlled substance. You can't share your prescription pain medicines. Don't mix prescription pain medicines with alcohol or tranquilizers. Doing so can be dangerous and can even be deadly. And finally, be responsible for others too. When you're prescribed pain medicines, you have to take responsibility for them. You gotta lock them up. You've gotta lock them up the same way you would anything that's dangerous in your house. And with the number of deaths that we're talking about, I think you know exactly what I mean. You gotta lock up anything that's dangerous in your house. You've gotta lock up your prescription opioids. You can't let others have access to them. Patients should know that emergency room doctors and emergency departments will always make it a priority, as Dr. McCullough said, to relieve acute pain from injury or illness. These guidelines were developed to promote safety and to minimize potential abuse, diversion, and deaths from prescriptions. This task force is uniting with physicians and emergency department staff, providing them with the tools and the guidelines that would help them to communicate these practices to all of our patients. We can reduce opioid overuse, misuse, abuse, and deaths. As doctors, nurses, and as patients, we can make Los Angeles safer for ourselves, for our community, and for our children. Thank you very much, Dr. Hyatt.
Thank you. I have a few final comments just to wrap up. I thought it would be important to clarify what prescription opioids we're talking about. These are commonly used prescribed opioid medications. Hydrocodone, otherwise known as Vicodin and Norco. Oxycodone, otherwise known as OxyContin or Percocet. Morphine, hydromorphone, otherwise known as Opana, and others, fentanyl. These are the prescription opioids that we're talking about that are killing people, that are being overused, misused, abused, and diverted. We ask for your help as media to raise the community awareness of this opioid overprescribing epidemic and of this community-wide effort, starting with emergency departments, to develop a united stand for consistent, safe, and appropriate pain management and prescribing practices. We want to recognize the help we've gotten from San Diego and Imperial counties, Kaiser Permanente, and the California chapter of the American College of Emergency Physicians. We have expectations that these guidelines will be adopted by emergency departments in other counties in California, knowing that LA County has the largest number of emergency departments in any county in the state, 75. Our task force has plans to measure vital statistics with the Department of Public Health to monitor the impact of this and other opioid prescribing initiatives. And our task force will be discussing how to expand this kind of effort beyond emergency departments to other clinical settings where most pain medications are prescribed.